Welcome to Healthcare Connector, a podcast for amplifying the voices of women and people of color in healthcare.
Hi, everyone, and welcome to another episode of the Healthcare Connector. Today we have Miss Dr. Let me get that right, Dr. Chelsea Mooreland. Don't want to mess up anybody's title. And you know I don't like to beat around the bush, so we're going to jump in and get started and hear the voice of another woman of color in healthcare. So, Dr. Mooreland, can you give us a little bit of background about what you do and your journey to this point?
Yes. So I am a full spectrum family physician, which means that I still see all ages. Some would say we provide care cradle to grave. I still do treatment for substance use disorder, prenatal care. I'm currently based in Central Ohio, and I most recently opened a direct primary care practice.
Oh, wow. So that is good. Now, did you always know that you wanted to be a doctor? So that's the first question. And to go into primary care, because as those of us who work in healthcare know, there's a shortage of doctors in primary care.
Yeah, so I definitely did not know that I always wanted to be a doctor. I did know once I decided that I wanted to do primary care. So when I was younger, I actually wanted to be a teacher, a basketball player, and a drummer. So I wanted to do everything. Yeah. And it was not medicine. But I would say medicine kind of found me. So as I went into college and started to really learn kind of what did I thrive in? I loved science. I loved talking to people, and I loved providing education. So my dream used to be being an AP biology teacher. And so I found that in medicine, I can kind of marry all of the things that I enjoyed and loved, because I could form these relationships and really engage with people in a way that was meaningful and educational. A lot of the education, which we tend to miss out on because we have a primary care workforce, but I would say specifically in the minority community, I think we tend to get the short end of the stick, and we don't always have providers who are willing to spend time with us and really do the educational piece of healthcare. And so once I decided I was going to go into medicine, I actually was very strongly set on doing obstetrics and gynecology. Specifically, I wanted to work with young teen women to help prevent early pregnancy, as well as to provide care in the prenatal period. But then towards the end of medical school, I actually did a rotation at a local community hospital that did full spectrum family medicine. And I was like, man, so I can do all of the stuff that I love in family medicine. I don't have to go and do surgery for hours and any of those things. I can just care about families and still do deliveries and see the babies afterwards. And I was like, well, this is it. And I definitely don't regret my decision. It's been amazing.
I love it because you get to work with, like you said, people along all the lifespan, the spectrum, but also there's a chance for you to help people before it turns into a big problem. And I think a lot of that is needed. So I heard you say you just opened up your own practice. Tell us a little bit about your practice and what makes it different from all the other practices that are out there.
So we launched September 3rd of this year, so it's still very new.
Yes.
I spent the last 2 years working in community health at a local federally qualified health center. And in that time, I really learned that, the health disparities that we see aren't just because of a lack of access. And because most people think access is, I have a physical place to go to and I have someone's name to put on my paper that says this is my PCP. And so the FQHCs and some of the free clinics, they check that box. But the quality of the provider that you see and the continuity that you have with that provider is extremely important when we think about having better outcomes and better relationships. And so that's what drove me really to start the practice and to specifically choose a direct care model. And so in direct primary care, we don't use insurance, which means I am not required to abide by insurance's laws and expectations in order to give you good care. I can do what I see best for you and help you save money. And so medicine has over the years become just a big corporate business. And it's been much more about making money than it has really been about making people healthier or improving the health of overall communities. And so in this model, I really get to focus on providing full family care. And so most of our members are here with their whole family, so the children, the parents. And when we talk about interventions and appointments, I don't have to worry about, I got to see 25 people a day in order to pay the bills. It's a subscription or membership based model. And that membership allows me to see patients for a full hour every visit. If that's what they need. If they want less than that, that's fine too. And I can take them out of the office. And so if they need me to go grocery shopping with them, if they need me to see, meet them at the gym, if they need to call, text, email, video, visit me, all of the options are open now. And so we remove all the barriers and limitations that insurance creates, and we save families money. I mean, what better way to help you be healthy than to help you be able to afford healthier foods or afford the gym membership, and afford, better quality education, all those things. And so we do that by getting patients access to wholesale medications, labs, imaging, and you would be surprised how much money people save. I mean, it doesn't benefit me financially, it benefits them. And so if I save you $800, that's more than your annual membership just from one test.
I love it. I mean, because who doesn't want to save money? But I also love the fact, because I think there's this perception, especially people of color have, that the doctor comes in, the doctor's only in there for 2 minutes and they're right back out. Like you see them speed in and then you see them speed out. And so it sounds like in your model, you're doing away with everything that we have traditionally known or have experienced as people of color in healthcare.
Absolutely.
So you've been going on this journey to start the practice. And I talk with like a lot of people who go down this entrepreneurial journey. What have you learned about yourself in doing this? Because it's hard. It's not easy.
I would say the two biggest things is I learned how to create safeguards around my weaknesses. And so I'm really good at the medicine. But being a businesswoman is an entirely different ask of myself. So keeping track of invoices and applying for loans for a business and all these things, they are completely new for me. But I've been able to learn how to be more organized and set reminders and create a team and be okay delegating tasks so that the things that I know I'm not strong at can still be strengths for the practice. And then I would say the other thing, too, is just learning what motivates me. And so I am heavily motivated by relationships with patients. And so when I was working in this big system where I truly had no connection with my patients, or it was very short, 5-minute connection, that lack of responsibility to the patient really impaired my ability to give good care. Because it's knowing you, it's knowing the family, it's knowing what you've been through and what's been tried before that helps to drive me to say, we're going to get you answers and we're going to make change for you. And I'm committed to that. So those are the two biggest things I've learned so far.
I love it. Can you tell us, because I'm not sure if I missed it at the beginning, and this is amazing, so I don't want anybody else to miss it. Tell us the name of the practice again. And we'll make sure to put this in the show notes too, you all.
Thank you. So my practice is Life Cycle DPC, or Direct Primary Care. And I named it that actually because we are one of the few direct care practices even the few family physicians who offer full spectrum care still. And so our goal is to follow patients across all of life's different changes and seasons.
So you all would be the person's constant through everything, basically.
Through everything.
And who would want that again? And like you said, you're not, what I love, what you're a part about what you're saying is it's not dependent on any insurance. And so a lot of times when you all of us know, like when you switch jobs or your insurance is changed, then you may have to change your doctor and then get used to a whole new person. And I know I don't like that. So I love that idea of what you're doing as well. What do you think is a misconception that people have about what you do, about having a practice, about being in family care, or about doctors? So any of that, what's a misconception that people have?
That is an excellent question. And there are so many.
That's why I say it goes so many ways.
Being both a patient and a physician, I feel like I can understand why those misconceptions are there. I would say the first one I would mention in terms of just being a doctor, I think people just automatically assume that you are rich, that you come from a certain background. And being a physician female and a physician of color, it couldn't be more far from the truth for me. And so I still remember going through medical school and I had an attending make a comment to me one day. He said, those patients aren't like us. And I was like, wait a minute, I don't think I understand what you mean here, other than that you think this white coat somehow created a similarity between us that really isn't there. I came from a single parent household. I had a father who struggled with substance use disorder, and I was the first in my family to graduate from college. So my background is very different than some other physicians. And so it is definitely a stereotype that I think we all are constantly fighting against, because it makes barriers in the room with the patient. If they perceive that you don't understand their struggles or don't understand their family or life dynamics, it's harder for you to make suggestions and help them change things. So that's one misconception. The other is that we get paid by insurance. So even in the traditional model, we aren't paid directly from the insurance company. We're paid from the big system, but we're paid on a salary. So whether or not we provide great care to you or really terrible care to you, it honestly doesn't affect most physicians' pay. And in a direct care model specifically, it really affects my pay if I provide bad care, because you're not going to continue your monthly subscription. It's like Netflix. If you don't like it, if you don't use it, you're going to unsubscribe. So I want you to benefit from coming here. So that's another misconception I would say about our practice specifically. And then the third one I'll mention is that direct care is for the rich. And so a lot of people hear me say, we have a direct care practice or a cash pay practice. And people automatically assume that we are only for people who make a lot of money. Kind of like what concierge medicine used to be, which is kind of like the medicine to the stars. And it's a similar model. And that's our goal, is to provide concierge-like care where you have your primary care provider kind of on call for you at all times. The big difference is that in concierge medicine, you get double billed. You pay a much higher price per month or annually, and they still bill your insurance. So you still get the co-pays and deductibles and whatnot that you would. So they're getting paid from two sources, and they can reduce even further how many people they see and care for. In our DPC or direct primary care world, our goal is to make memberships affordable for most patients, because we truly believe that everyone should have access to care. So whether you are insured or uninsured, our goal is to help you save money and be healthier. And so in our membership-based practice, specifically for Lifecycle DPC, I made sure our price points were no more than 2% of the annual household income for the average family size in our area, which is 3. And that was based off the lowest 10th percentile of earners in our area. So our goal isn't to be unreachable. A lot of our patients in my area that I live in right now will be at a much lower threshold than that 2%. But at the absolute most, it should be 2% of your annual household income, which isn't a whole lot for unlimited access to someone, and someone who is really invested in the care of you and your family.
Wow. So I want to repeat this back out, because I want to make sure people hear this, because it's, again, like, I'm over here amazed. One, the lived experience that you have that makes you relatable, a doctor that I would feel comfortable, my son, my daughter, my partner, the other people that look like me will feel comfortable going to. So you get that. 2,
Absolutely.
You get the quality of care because of the way the model is set up. It's just, like you said, it's just like with Netflix. If you don't do a good job, then you can leave. And so that forces you to do a good job for everybody that walks through the door, no matter what they look like. And then third, you said it is affordable. And so again, like me, like lots of other people out there who think about that idea of concierge medicine, or what you've seen on TV, it depicted as it is out of reach. It is only for the rich and the famous. And you all have found a way to make it within reach of everyone. So all of you all that are listening, if you are in the Ohio area, you need to make sure that you check this out, because like, you got the 3 things that we need and that we're missing. So I definitely really appreciate that. What the next question, if you could go back to the other end of your lifespan, 16-year-old Chelsea, what piece of advice would you give yourself?
Man, honestly, the very short and simple would be hang in there. When I was growing up, like I mentioned, I was raised by a single mom. My dad had substance disorder issues, and he actually passed away when I was 8. And so I was one of those really, I love school kind of kids, but in part because school was my refuge. It was kind of the place that I went to find peace and consistency. But I found myself in middle school and high school, as a lot of young women do, kind of searching for pieces of myself. And so I got into a whole lot of trouble, not academically, And so I kind of skated under the radar because people were so busy worried about my report card that they really weren't thinking about my mental health or my sexual health. And so I found myself getting into a lot of things that I didn't need to get involved in. And I put myself in really risky situations. And it's so crazy because in hindsight, it's like, man, I really did these things, but I did. And so if I could speak to my 16-year-old self, it would literally be, hang in there, because things won't always be this way, and you will have resources and you will see things that you've never seen before, and be able to fill these voids with something different. So yeah.
I love that. Definitely the hang in there, but also the part about, because it made me think of myself, is just because you see and you think someone has it all together, and when we're teenagers, for me, that meant making a good grades. That does not mean that person had it all together. Because that would definitely be getting in trouble in every other aspect of my life. But I knew how to bring home an A, and that would, that would keep people off my back a little bit.
Exactly.
So we go, so we went back that way. Let's shoot forward. Where are you going to be? Where's the business going to be in 5 years?
Yeah. So I have huge dreams.
I love it.
And so ideally in 5 years, not only would we have expanded to at least 3 other locations, because Columbus, it kind of has like a rectangle, the way that the freeways run around it. And so all of the 4 corners of Columbus is where I really would like us to have a presence, again, for that access piece and relationship piece. And so a lot of the diversity in Columbus is kind of in pockets. And so having those 4 main locations will allow us to access all of the different diverse pockets in Columbus that can really benefit from a community of physicians who are truly invested and understand the perspective of those diverse populations. And in addition to that, I am hoping that we'll be able to add other services. So Columbus is one of the few large areas, like large metro areas, that does not have a birthing center. And so I still do prenatal care. I am a huge advocate for ways that we can help, reduce the maternal health crisis for African American women. And so I also do group prenatal care, which is called centering pregnancy. And it has great evidence. But even beyond that, the birthing experience for minority moms, Black moms, it's been so, it's been kind of everywhere right now. Everybody's highlighting it. But birthing centers are a wonderful thing because we can still give people access to high quality obstetric care and a high quality delivery setting, but close enough to a hospital that in case of an emergency, they have access. And so when we think about our obstetrics workforce, it's not just OBGYNs. There are physicians, there's doulas, there's midwives. And a lot of times in big systems, everyone other than OBs get pushed out of that process. And so we have an opportunity with a birthing center to bring those of us into the fold who really love our moms and babies and be able to provide them a better experience at a reduced cost to help save them money and give them better outcomes, because we know in hospital settings, when we deal with more bias and other things, that we have more interventions and worse outcomes. And so I'm hoping that we can branch off into that space and really start to reconnect some of the people who are invested in this work to the work, because they don't have to depend on the big system to come up with a solution anymore.
And I love it. And I'm not saying hope. I'm just claiming that for you, because there's no doubt in my mind that we're going to get that, and that it is much needed. Again, like thinking about my experience, my first child had a OBGYN that did not look like me, and it wasn't the greatest experience. My second child found someone that looked like me, totally different experience. And so it is a much needed service that is out there. What is the biggest challenge that you're facing right now?
Honestly, I would say the biggest challenge right now is just trying to balance everything. So as a entrepreneur, and coming from my background, I didn't have this big nest egg to turn to say, hey, mom and dad, I want to start a business. You invest in it. I'm just going to solely focus on business. So I work 7 days a week. And some people were like, you're crazy. Why would you do that? But I'm a firm believer that dreams don't work unless we do. The same way that people, that we know faith without works is dead. Same thing. I know that eventually God's going to prosper our business and I can back away from working 7 days a week. But right now, what's necessary is me working another job to be able to make an income while the practice builds, so that I can let it build organically and not be stressed about that. So that's been the biggest challenge is really just balancing working 7 days a week and being a mom of four and being married. And so there's a lot of different dynamics here.
You threw that. So you do everything, and then you threw the mom of four on top of it all. I'm sorry, I didn't mean to interrupt you. What tips do? You like you just said, like it takes work to stand this up and to accomplish your dreams, and you're working and you're a mom. What are there any tips that you have for people on how you found this balance?
Yeah, absolutely. The number one is having God first as the head of my life, and really being able to have discernment so that I can understand when something's awry in my household that we need to focus on. And then two is having a supportive spouse. It's huge for me, because if I did not have a supportive spouse, who would pick up my kids on days that I'm running behind, or, who would help out with reviewing homework on days that I just can't do it. And so he really does understand my assignment in life, and he supports it and backs it 100%. And it didn't, it wasn't like that always. And so being patient with your significant other and finding a spouse who really is invested in what God has given you to give to the world is so important. In starting the practice, it was a huge adjustment for him, because he's like, so you went from having this guaranteed income from a job and that stressed you out, and you're going to go find another stressor. But without even having to really debate it, I just prayed about it, revisited it a few months later. And at that point, when I mentioned it, he's like, well, why wouldn't you do it? And I'm like, there you go. Because God moved on him to let him know this is her assignment. It's not about will it happen. It will. I just need you to support her through it. So those are the top two things, is having my spiritual life together so that I can know what's most important and prioritize effectively. And then having a supportive spouse who can help me balance the schedule, because obviously we have 4, 5, 6 different schedules to balance. And he definitely offsets my weaknesses. So that's the other thing. My spouse is not only supportive, but we are so drastically different. And so the things that I am really weak in, he is very strong in. And so when I'm usually disorganized, he's like, here's the calendar, here's the scheduled events. I sent you invites on your calendar, just accept them. Great.
Yes, you're right. Those two things are key: getting your spiritual life in order and making sure that you're walking along the right path. Because sometimes we got our own ideas that take us left, and that's not the way we're supposed to be going. And that's when things don't work out. And then having someone that supports you and that understands that, she got that crazy idea, but I'm going to support her through that crazy idea. So that I like both of those. Next question that I have for you. So I've asked everyone this because we hear a lot about the great resignation of people in healthcare. And I've talked with a lot of people who have decided to just, especially doctors and nurses, the member-facing roles, have just, said, I'm leaving. What has made you stay? Because not only are you staying, but now you are, creating this, practice as well. So why are you staying? What has motivated you to stay and not be one of the ones that has decided to leave?
So honestly, a year ago, when I was working the job that I absolutely hated, I was to the point that I was so anxious and depressed about going to work. Like I was having chest pain going into work every day. And my husband completely didn't understand. He's like, it's just a job. You just go and do it and come home. But it wasn't just a job, because morally, I was in a place where what I did every day was in extreme conflict with my morals and values. I was running people through an office, seeing 25, 35 people a day in the same number of time that, somebody else would only see 10 or 15 people. It was crazy. And I really felt like I was a part of a system that didn't value Black and brown bodies. And I was like, I just can't be in this. And so at that moment, I had to make a decision. Was I going to stay in the broken system and figure out how to deal with the emotions of being in that system? Or was I going to create one that I can still operate in the space that I'm good at? And that's what I chose to do. And so that's where the direct care model for me, it aligned with what my morals and values are and allowed me to still be in the space of healthcare and make changes and benefit patients, and not just fully pull away. So really, it was just finding a way. And I think that's why a lot of people are leaving, because it seems like there is no other way. And if there were one, wouldn't everybody choose that way? how did you just find the one thing? But DPC has been growing. And so for me, it was finding that other avenue and believing in my gift, because that's the other thing. When you go through healthcare, most programs, they teach you to follow algorithms and do what you are told. And so it's an entirely different mindset to now step out on your own and not do what you're told, to go against the grain. It seems impossible, but I know that what I just invested in all these years is valuable, and the system doesn't exist without us. And so I had to accept that and meditate on that every day and literally remind myself of that, to say I can go out here and create my own and it will still thrive, because people need doctors, people need healthcare. So really, I think that's really it. It's just kind of accepting that what you have is unique. It is not replaceable. No matter what the larger healthcare industry tries to make any of us believe, we are not replaceable. No matter who they bring along or try to train quicker or pay less money, it doesn't matter. You are not replaceable. And even just from a lived experience standpoint, what you bring to your patients, no one can replace that. And so build your own. Be a consultant. There are plenty of companies that need consultants. And so your knowledge is valuable.
Definitely. And Dr. Mooreland, you are the epitome of the type of person that I wanted to have on the show, because you have found a way to use your knowledge, your skills, and your experience to create something that works for you. And what wasn't working, but you still say, like you said, I am valuable. This is needed. I'm not going anywhere. I just got to figure out how to create the situation that's going to work for me and my family. So that's, I'm so glad that we had you on the show today. What are you most proud of?
Man, honestly, I'm proud that we opened.
That's a big mouthful.
Man, I mean, in February, when this idea first was like, all right, this is do or die, let's register this business name. It was like, man, are we going to get there? I mean, we had hold up after hold up when it came to like our business loan and everything. And it took literally 4 months to get my business loan. And I thought I was starting early in the process. And every hiccup, I was like, man, okay, are we really doing this? Maybe I should pivot. Maybe this isn't supposed to work out okay. And there are a lot of businesses who fold before they ever open because they just keep waiting for it to be perfect, or they just keep waiting for something else to come through. And so I am just really proud that we stuck it out and we opened, and we are close to ending our 3rd month in business, and we are doing fantastic, and patients are so happy. And so I'm proud that we took the leap and we opened.
And we opened. Yes, you did. Now, was there someone or a resource that helped guide you through this process? Because, like you said, it's not easy. Getting the business loan is easy. I'm amazed by the fact that the idea was in February and you opened up in October. Like, that's still very quick. So what are there any resources you can recommend, or something that you did, coach, mentor, whatever, that helped guide you along that way?
Absolutely. So I didn't officially decide that, yes, I was going to do it until February, but a year prior, so that summer before, I had actually attended a direct care conference to really kind of learn what it was and see, was it really in alignment with what I wanted to do? And then there were books written on direct primary care. And so I took time and read the books cover to cover to see, like, man, is this realistic? How long, what's the timeline like? How do most people do this? And then I started slowly writing a business plan. So literally just doing a brain dump to say, this is what I envision. This is kind of what I need to piece together. And then come February, when I really decided, yep, we're going to do this, I literally Googled like local small business resources. And so the SBA, here locally in Columbus, the SBDC, and I think it's Ohio wide, they all had free classes. Literally all the classes that they were free. Even longer courses that would walk you through and give you homework assignments to do a business plan, to do a profit and loss statement, all these things that were completely new to me, all free. And so I did those sessions from February until about May. But so by the time I finished, I already had my business plan written. I already had all the financial projections that I needed, and understood the different financing sources so that I could then move forward with applying. And all those same resources will give you a completely free business mentor and help connect you with resources. So if you need an accountant, if you need a lawyer, all of that, they will give you those connections. So yes, I definitely used help. It was not all me.
Good. Yeah. Well, we all need help. And so part of what I hear you saying, or what I want to put out there to people, is no excuses. You don't have to go out and, if you don't have the money, you don't have to go out and get a really expensive coach or take all of these courses. There are things right in the community, like the SBA, like minority driven programs, things like that, that will walk you along this path if that is what you want to do. So how can the listeners support you and your business?
Well, number one is follow us. So follow us on social media, on Instagram, on Facebook. It's a Life Cycle DPC. Okay. Or at Dr. Chelsea Mooreland, so either one. And that really just allows us to really be engaged with the community and kind of know what you all want to learn about and what resources we can help you acquire. And then also over the next year, we do plan to actually start doing an annual fundraising event, because again, my goal is to make healthcare accessible for most. And so if people fall above that 2% annual household income, if they were to be members, we want to give them opportunities to offset that cost so that we can really make an impact for everyone in our community. And so when you see that announcement go out, if you are in Central Ohio, we want you to sign up, participate in the fundraiser, donate to the practice so that we can provide care to persons who would really benefit from this kind of concierge-like care, but just can't quite afford it because of whatever situation they're in. So those are the two biggest things. And our website, lifecycledpc.com.
I love it. Okay, you all. So you heard that. That is something that we can do. Once you finish listening to this, I want you to go and blow up Dr. Mooreland's page and her social media. Share it. Make sure you tell everybody about it. If you know people in Ohio, get them over there, because we want this business to grow and to blossom and for all of her dreams to come true. So thank you, Dr. Mooreland, for coming on the show and for telling us about your business and how you are using your knowledge, your skills, and your experience to create something not only for yourself but for the community. And so, what else can we ask for? Thanks for being on the show.
Thank you. Thank you so much for having me today.
Okay.